Hello there, I'm Rosanna Lockwood. Welcome to Investing in Health for All, brought to you by Project Syndicate. A devastating global pandemic, killing millions of people and rocking health systems rich and poor. In its wake, millions more left untreated for other diseases and primary and hospital care teetering on the brink. A turbocharged scientific drive to tackle the virus, but can we ever expect to see the same urgency and resources again? As governments face further pressure from an energy crisis and rising global commodity prices, can we rebuild and deliver a resilient, universal health system for all? Well, this afternoon, we hope to find out. Kicking off that critical conversation for us today will be Werner Hoyer, President of the European Investment Bank. He's joined by Tedros Adhanom Ghebreyesus, Director General of the World Health Organization. They're going to be giving us the benefit of their decades of experience very shortly. First, though, we'd like to tell you, if you want to be part of this conversation, fear not, a cure has been developed. Let us know what you think about the conversation using the hashtag #InvestingInHealthForAll. Now, though, as promised, let's get straight over to Luxembourg. Let me hand over to EIB President Werner Hoyer.
Thank you very much. And welcome, Dr. Tedros, to Luxembourg and to the European Investment Bank. It's a pleasure to welcome you all to the Investing in Health for All event organized by WHO and EIB. Today's event brings together leading health specialists from around the globe from private and public sectors. And the European Commissioner for Health and Food Security, Stella Kyriakides, will be also with us here today. So together we will discuss how to build more resilient health systems, how to improve access to health for all, and what needs to be done to be better prepared for pandemics and to fight chronic diseases through global partnerships. This afternoon I'm surrounded by good friends, among them in particular one with whom we developed a close collaboration during the pandemic in particular. Dr. Tedros Adhanom Ghebreyesus, it's a pleasure to welcome you here, and the floor is yours, Tedros.
Thank you. Thank you, Werner. President Hoyer, Excellencies, dear colleagues and friends, good afternoon, and it's an honor to be here. And I thank you, President Hoyer, for your hospitality, and also for your leadership and partnership in health. More than 2 years ago, our institution signed a memorandum of understanding, and since then, we have had a very productive relationship, working together to support low and middle-income countries to make progress towards the health targets in the Sustainable Development Goals. The COVID-19 pandemic is a powerful demonstration that when health is at risk, everything is at risk. The pandemic has disrupted societies, economies, businesses, trade, politics, education, and many other facets of life. On the other hand, when health is protected and promoted, individuals, families, communities, economies, and nations can thrive. The best way to do this is to invest in and reorient health systems towards primary health care at the foundation of universal health coverage. More than 90% of essential health services can be delivered through primary health care, including many services to promote health, prevent disease, and avoid or delay the need for more costly secondary and tertiary care. As the eyes and ears of the health system, primary health care also plays a vital role in detecting outbreaks at their earliest stages. We thank the EIB for its commitment of 500 million euros to support primary health care in sub-Saharan countries, and we welcome your plans to extend this partnership to other countries and regions. This investment will provide much needed support to national governments and to strengthen primary health care and improve capacities to prepare for, prevent, and respond to health emergencies. Our partnership also extends to other areas such as polio eradication and pediatric oncology services. These are very important. This work has already begun in Africa and the Middle East, where WHO is guiding EIB's investments to ensure maximum impact based on country needs. These investments come at a crucial juncture. Currently, the world is going at 1/4 the pace needed to reach the health-related sustainable development goals. As an example, consider that even before the pandemic hit, the estimated annual financing gap for 67 low and middle income countries to reach the health-related SDGs was $134 billion per year, rising to $371 billion by 2030. Things have only become more difficult, and the pressures on economies and multilateral institutions greater in the wake of COVID-19. Globally, we face a confluence of crises with conflict, migration, inflation, food insecurity, and the existential threat of climate change, with more frequent and more extreme droughts, floods, hurricanes, and more. International finance institutions will play a critical role in supporting countries to meet these challenges. Resources are finite, precious, so it's vital that we tailor and target investments carefully for the biggest impact. That's what our partnership with European Investment Bank is all about. WHO is grateful to have a partner in President Hoye and the European Investment Bank, which recognize that an investment in health is an investment in healthy, prosperous communities and in the future. I thank you. Vielen Dank, Mr. President, and back to you.
Well, thank you very much. I think the main takeaways from the experiences with the pandemic are twofold. Number one, functioning health systems, in particular primary health care, are not only an ethical challenge, they're an economic imperative. So we better invest into these spheres if we want to rise up to our responsibilities, but also rise up to the economic challenges that the world has to face. And second thing is, and this is probably totally underappreciated nowadays, how we are tackling these challenges is key. It requires the recourse to human ingenuity. Without latest technologies, without our trust in our scientists, we would not have made it. I remember that when COVID appeared on the horizon, pharmaceutical experts told me it takes 6 years to develop a vaccine. And then all of a sudden there were relatively small companies who said, well, we can do that in 6 months. So it's really amazing, and we should bet and count on this kind of support.
Dr. Tedros, we would like to give you the opportunity to respond to those comments by Mr. Hoyer just now.
No, I think I fully agree. Investing in health is not a cost, as he had said. It's actually an investment in the future. And especially in primary health care, I think it's very, very important because we have learned our lessons from this pandemic, And with lack of investment in primary healthcare, we have seen even the high-income countries were surprised, really seriously surprised by the pandemic, because if there was strong primary health care, they could have fared actually better. So one thing I'd like to add to President Hoyer is the investment we're saying on primary health care is for all countries, actually, all income levels, whether it's high income, middle income, or low income, because this pandemic has shown us the really lack of capacity, especially at the primary healthcare level globally. And I fully agree also with not only invest in primary healthcare, but in technologies. And as he rightly said, the speed with which the COVID vaccines were developed was actually very historic. This is the first time in our history, in the history of the humankind, when vaccines could be available in months, not in years. And the use of technology, investing in technology to prevent future outbreaks, and when they happen, to fight them like we did, is very important. So I fully agree. But one thing I'd like to maybe say here is, many donors invest mainly in what we call sexy programs. It could be in malaria, HIV, TB, some vertical programs, while investment in strengthening health systems or in strengthening primary health care or investment in primary health care, like the European Investment Bank or President Hoyer is doing, is actually something that's not taken seriously for many years. And I hope with this investment, not only are we getting the investment from the European Investment Bank, but I hope other donors will also really take this seriously, invest in health systems, because investment in health systems, in primary health care, is very important to provide services. It's very important to also prevent outbreaks, and investment in primary health care is also important to detect outbreaks early and stop it. So without a system like primary health care, from prevention to provision of services to early detection of outbreak and response, cannot happen. So our services and the rest will always depend on a strong primary health care. And I hope this investment by the bank, by the European Investment Bank, will be taken as a good example, and by other, to be followed by other international financing institutions. And would like to thank President Hoyer for this investment.
Well, thank you for the very kind words. Let me just add one thing. I'm not a believer in doomsday scenarios. So I think we have seen here in the case of the health crisis that we need to believe in our innovators and technologies. And this is the only way to get through, for instance, the energy crisis that we presently see. Only with the latest, most advanced technologies will we be able to perform the energy transformation. So we can learn from the health crisis.
Using the health crisis as the template for other types of crises as well, and also that investment in primary healthcare, setting the standard, as we heard there, and hopefully setting the example for others to follow. We now turn to our group of journalists from around the world who are on standby for us to ask questions to our gentlemen in Luxembourg. First off, we'd like to go over to Joan van Dijk, who's news editor at the Bekesisa Centre for Health Journalism in South Africa. Joan, please do give us your question.
Thanks for having me. So at the start of the COVID pandemic, we were learning a great deal about the virus very quickly. And as a result, policy guidance from the World Health Organization was changing as researchers understood more and more. I'm thinking of the mask policies, for example. It's something that's unavoidable if we ever have a situation like that again, but it did cause a bit of distrust from the public. My question is the World Health Organization thinking differently about how to build uncertainty into communication strategies to prepare the public for possibly changing policies as the pandemic continues?
Dr. Tedros, we will let you answer that question on behalf of the WHO.
Yeah, no, thank you. Thank you so much. I mean, when this virus hit, that's in end of 2019, early 2020, there were lots of unknowns. What we didn't know was a lot, while what we knew was almost nothing, just a small part. So, as you rightly said, it's when we start to know better about the virus, then the recommendations on what to do also started to flow. But even without really knowing exactly the behavior of the virus, from experience in the past, we were taking precautionary methods to suggest what kind of measure should be taken. So it's with the knowledge of the virus that you can, propose more actions. But even without knowing much, you can take the precautionary route and propose advices to the community. But sometimes it could be difficult. For instance, you have raised the mask issue. From the start, based on evidence, our recommendation was to use masks. But masks were not in the market. Forget about the use by communities, but even health workers were not getting enough masks. So our recommendation was not to misuse the masks that we had. We gave priority to use by health workers. And then, of course, when the production capacity increased, when the availability increased, and many countries who have been hoarding also, when they produce more, they started to release. Then, of course, we started to move to the community level use. So there are sometimes a matter of choice when you're forced to go one way or the other, even if you have the evidence because of shortages. And there may be two bad things, and you will choose the least bad. So I think it would be important, as you rightly said, to really take this into consideration in our communications to the public. But thank you for that question. And I assure you that we always focus and take into consideration science and evidence-based approach, but we may be forced to consider other parameters when there is market failure or shortages in the market of the products we prescribe.
Thank you, Dr. Tedros. Masks, they're obviously a very tangible thing many people can understand, and policy guidance, something else we'll be considering today. Now, though, we'd like to pose our next question from our next guest journalist, Dr. Mercy Korir, Health and Science Editor at The Standard in Kenya.
Thank you, and thank you very much for this opportunity. My question originates from the experience that we saw during the COVID-19 pandemic, where there was an inequity between the global north and the global south in regards to sharing of vaccines and health technologies that were necessary in managing and stemming further spread of the disease. So how do we guarantee that in the event of a future pandemic or a health crisis, we do not experience or go through what we saw in regards to that inequity? Thank you.
Let's pose that question from a health perspective once again to Dr. Tedros, and then also if we might be able to get a comment from President Hoyer there regarding financing with regard to the global north and south. Dr. Tedros?
Okay, thank you. No, the equity issue is very important. And when we say equity, though, it should be both at country level and also global level. And to address equity, I think addressing the systemic problems will be very, very important. One is investment in universal health coverage. if we invest in universal health coverage, it means equity. And that's why we push countries to commit to universal health coverage, especially with a strong foundation on primary health care. And then the other part is, as you rightly said, it could be equity in relation to access to some products like vaccines. As you know, vaccine production is monopolized in few countries, and especially once the vaccine started to be produced, some countries were taking most of the share and even hoarding. Because of that, there was inequitable distribution of vaccines, and most vaccines reached actually the low-income countries months after they started to be used in high-income countries. And this has to change, and we have been advocating for this, but not only advocating, but we have already started to make progress. One of the areas where we're investing now is the local production of vaccines in low and middle income countries. And many countries have already started in Africa, in Latin America, in Asia, and other regions in the Middle East. And we have the mRNA hub in South Africa, which is going to help in technology transfer of the mRNA technology. And I'm really glad that EIB is also involved in this, in addressing the equity issue in local production, in building the capacity of countries in local production. And I hope this will address the challenge or the systemic problem that we have. But in addition to this, we have also started the negotiation. Now our member states have started negotiating on pandemic agreement or pandemic accord that we believe will have a strong component of equity that will make sure that there is obligation, global obligation to share products, not only vaccines, but other products that may be needed in the future equitably. So 3 areas, as I said, we're investing. One is the universal health coverage, strong foundation primary health care, local production, building the capacity of low and middle income countries. And third is the pandemic accord, which is being negotiated, that will hopefully bring obligation among member states. And in all this, there is a strong cooperation now with the European Investment Bank. And I hope the world will be better prepared and not repeat the same mistake in the future.
A very comprehensive response, Dr. Tedros. Thank you. And as promised, let's just go quickly to President Hoyer to get his comments there on how we can guarantee against inequity between the global north and south should a pandemic, or when a pandemic arises again.
Well, obviously, we need to strengthen pandemic preparedness around the world. And this challenge, which we have had 2.5 years ago, has shown that this is a threat to the entire world, not just to a part of it. So the response must not be divisive, but the response must bring us together. So therefore, the European Investment Bank is investing together with WHO in countries like Angola, Rwanda, Senegal, Ethiopia, South Africa. So we must bring the production, a safe production, to the countries concerned. Because some people believe that you produce a vaccine by simply pouring a couple of liquids together and then you have a vaccine. No, this vaccine must meet the highest standards on the markets and in science. And therefore, it is necessary to bring the experts together to produce economic systems in the countries where we operate, in order to make sure that we not only have an equitable distribution of the vaccines, but also that we have safe vaccines.
President Hoyer, thank you for that. Let's head to Bangladesh now. And Musa Mia, Associate Editor of the daily Bonik Barter, your question, please.
Thank you so much for giving me the opportunity. As you know that out-of-pocket expenditure for the healthcare continue to be the most significant means of healthcare issues in the developing countries. As you know, poorer citizens in Bangladesh cannot afford certain treatments or services are high out-of-pocket cost. On average, Bangladesh citizens must pay around 64% of total cost, while the government pays the rest. The system creates a significant financial burden for the families, sometimes forcing them into their forgo treatment or go into the debt. My question is, how can we reduce out-of-pocket expenditure and build an efficient healthcare system in developing countries like Bangladesh?
Turning that question first over to you, please, President Hoyer, about reducing out-of-pocket expenditure.
Well, this requires international cooperation and the availability of multilateral institutions like ours for the support of these efforts. This has to do with the immediate address to the people concerned, but also it has to do with the availability of companies going into that sphere. For a multilateral development bank, which is not a commercial bank, but one that serves a public purpose, it must be clear that we should go where a market failure exists. And when it comes to the problem that has been just demonstrated from Bangladesh, then it is obvious that the intervention of public institutions and multilateral banks is justified. And therefore, we need to increase our efforts there. That doesn't mean that we can do that alone. We need closest cooperation among the multilateral banks, but also with the member states of the United Nations and the World Health Organization and with the WHO itself.
Speaking of the WHO, Dr. Tedros, would you mind also then giving your insight into how the WHO could help with out-of-pocket expenditure in countries like Bangladesh?
Yeah, no, thank you. The out-of-pocket expenditure is a problem in many countries. And I think the strategic solution is, first of all, identifying health as a fundamental human right and commitment by governments for universal health coverage. Because when they do that, then they will definitely go for options in order to fulfill health for all. They may look for different types of options they have to introduce health insurance. It could be the Bismarck model, or it could be the Lord Beveridge model. And then, of course, from there, when there is insurance, then the health out-of-pocket expenditure could be addressed. But that alone cannot solve the out-of-pocket expenditure. We have to look into referral system itself. For instance, very minor health problem, people with many minor health problem, they go to secondary or tertiary level services, while they can do it in primary health care, and the cost could be reduced. So a strong referral system that helps to address the health challenges based on their capacity at each level will be very, very important. And the other, of course, among a long list that I would like to add is out-of-pocket payment can also be reduced if we manage the cost of medicine. For instance, many countries have a pool procurement that reduces the cost of drugs, and that impacts also how much you pay from your pocket. So exploring the pharmaceutical or the supply chain we have and the cost of drugs is also important. So these are few among other things that can be done to reduce out-of-pocket. But it's not just one solution that can reduce out-of-pocket. It's a combination of many factors actually that can help us to reduce out-of-pocket expenditure. The most important being the political commitment to universal health coverage. Thank you.
Thank you to all of our journalists for the questions today. Unfortunately, we are just out of time for this conversation, but it's been a fascinating one. Werner Hoyer and Tedros Adhanom Ghebreyesus, thank you both so much. Let's now get the thoughts of Stella Kyriakidis, European Commissioner for Health and Food Safety.
Health and healthy citizens are a fundamental prerequisite for equal, prosperous societies and strong economies. The COVID-19 pandemic has reminded us of this fact over and over again. But the pandemic has also taught us that health is no longer only the responsibility of the health sector, and that good health is an investment, one that will be repaid 1,000-fold. In the EU, we have swiftly identified structural weaknesses in our system, and we have proposed concrete solutions that will make a practical difference to citizens and to health systems. We are building a strong European health union in which all EU countries prepare and respond together to health crises, in which medical supplies are available, affordable and innovative, and countries work together to improve prevention, treatment and aftercare for diseases such as cancer. The Europe's Beating Cancer Plan and the European Health Data Space are key building blocks of this health union. So too is the pharmaceutical strategy for Europe, which seeks to ensure that the EU has a sustainable supply of affordable medicines, that the European pharmaceutical industry remains an innovator and a world leader. The EIB is a crucial partner in this process. Indeed, the Health Emergency Preparedness and Response Authority, together with the EIB, is currently exploring options to incentivize investments in innovative European companies, developing new vaccines, therapeutics and diagnostics against priority cross-border health threats. We are looking at how innovative public and private financing instruments could de-risk these investments, incentivizing private investment and filling the R&D pipeline for cross-border health threats. Today's event is gathering a wealth of expertise, perspective and experience across various sectors: health, research, crisis preparedness and response, and of course, international development, and crucially, finance and investment. And this is exactly the type of collaboration we need to deliver permanent solutions, stronger health systems, and concrete benefits to citizens.
Stella Kyriakidis there now. We've got time for a small break, but don't go away anywhere. We'll be back shortly when we'll be asking what it will take to build resilient health systems that can withstand future health emergencies.
March 2020, COVID-19 came as a shock. Suddenly, patients flooded hospitals and death rates skyrocketed. Overnight, economies stalled and the world went into lockdown. 9 months later, BioNTech, with finance from the European Investment Bank, released the first messenger RNA vaccine to tackle the virus. Vaccines are key to overcome the pandemic, but they need to reach everybody, everywhere. This is why we support COVAX, the global initiative to provide equitable access to vaccines. Together with other European institutions, we are also boosting Africa's capacity to manufacture its own vaccines.
This funding is going to reinforce the health security in Africa. It would create jobs, develop capacities in terms of know-how and workforce, while bringing new technology and helping Africa to be self-sustainable when it comes to vaccine manufacturing.
We are ready to support the expansion of mRNA technology, which was used successfully in COVID vaccines, to develop new vaccines that eradicate malaria. And we continue to work to strengthen healthcare systems in lower-income countries, like the National Health Laboratory of Rwanda.
It's going to be a huge boost to our efforts into improving lab, looking at specialized testing like sequencing, like research.
In the Western Balkans, together with other European institutions, we are building and modernizing hospitals with state-of-the-art medical equipment.
Za radiologije koju smo sa novim mašinama dograđivali, prepravljali postojeći prostor koji je pravljen tamo negde posle ili u vreme drugog svjetskog rata.
In Morocco, we provide finance to support healthcare infrastructure that improves people's lives.
Pour moi, l'hôpital de Salé est un hôpital unique de la région parce qu'il est très spacieux, il est moderne, il est très bien équipé et il est très accessible à la population.
From 2017 to 2021, the EIB has invested 17.8 billion euros in the health and life science sectors. In 2021 alone, more than 780 million people around the world are benefiting from our healthcare investments. COVID-19 is a wake-up call. It reminds us that health is a global priority. At the EIB, we continue to ensure that countries are ready to respond better and faster to future health challenges.
Hello there and welcome back to Investing in Health for All, brought to you by Project Syndicate. I'm Rosanna Lockwood. Now on to our first session of the day, the anatomy of resilience. Healthcare systems at all levels in all countries were battered by a pandemic that came out of the blue. Many were already underfunded and under-resourced. Others found they just couldn't cope with the magnitude of the crisis. Infections and chronic diseases that were prevalent before have not gone away, and it's just got harder to tackle them again. So how can we rebuild our health systems from the ground upwards to prevent collapse in the face of future emergencies?
They're fighting a war here and they're losing. The sheer numbers of people succumbing to the coronavirus is overwhelming every hospital in northern Italy.
Peru's underfunded health system is overwhelmed and oxygen is scarce.
The COVID crisis in India is intensifying.
The health system in Amazonas state is in crisis, and doctors are literally having to choose which patients to give oxygen to so that they can breathe.
Queens in New York is the worst infected district in what is now the world's worst infected city.
Well, to open this session, let's hear now from Thomas Östros, Vice President of the European Investment Bank.
What does it take to build more resilient health systems that are capable of preventing future disease outbreaks and emergencies? Let me start by outlining the problem. COVID-19 showed us that in a modern world, no one is safe from a health emergency until everyone is safe. We all need to work together. And rather than making us more prepared for the next health emergency, the pandemic has in many ways weakened our healthcare systems. The United Nations reports that the pandemic is threatening decades of progress in global health. It led to disruptions in essential health services, derailed progress against HIV, tuberculosis and malaria. Today, more children are missing out on essential vaccines than in 2019. This unfortunately clearly shows the weakened capabilities of our health systems. Alarmingly, long-term investment in health and life sciences may be further put on hold because of the current geopolitical situation, as already tight national budgets are being stretched by food and energy price shocks triggered by the Russian invasion of Ukraine. Fiscal pressures are increasing, yet long-term healthcare challenges remain. Long-term, sustainable investments is essential. To tackle the issues and help those in need, we need to create resilient and equitable healthcare systems. But we also need to make sure that they are supported by an effective and adequate workforce. What is clear is that we must prioritize investments in healthcare before the next crisis strike. From the EIB side, we take our lessons seriously. The bank stepped up to face the challenge when it was needed the most. The EIB, with the support of the European Commission, as Team Europe, worked to enable WHO, Gavi and CEPI to deliver over 1.2 billion doses of COVID vaccines globally via COVAX. This unprecedented global response helped to save millions of lives and demonstrated just how important collaboration is. Together with the WHO, we continue to mobilize investment to build resilient health systems based on a solid foundation of primary health care. In both Rwanda and Angola, through our mandates, we give funding for technical assistance to local WHO offices to support implementation of our EIB-financed COVID projects. And similarly, in Ethiopia, support to such local offices to set up national primary healthcare strategies and investment plans. Cooperation is the way to achieve this. It is hard to overstate how important it is to step up our actions to strengthen our healthcare systems to prepare them for the challenges ahead. We see monkeypox spreading, polio coming back. That's why the EIB remains committed to maintain the level of support we mobilized in response to the COVID-19 pandemic beyond the end of the pandemic. Therefore, we are reinforcing health priorities in our policies. And to maximize our impact, we look forward to working together to catalyze investment into inspiring developments and drive a better, healthier future for all.
Thomas Östros speaking there. And just before our panel, a word now from Dr. Fernando Prados-Roa in Madrid on how the pressures of the pandemic there forced his teams to adapt and adapt quickly.
En Madrid, la primera ola supuso una convulsión por parte de todos. Fue una convulsión porque llegó de una forma muy brusca, el sistema no tuvo tiempo de prepararse y tuvo que improvisar soluciones para que el propio sistema sanitario no colapsara y pudiera ofrecer a todos los pacientes la sanidad del siglo XXI que hoy tenemos. Por eso, entre las soluciones más importantes fue la de establecer en el centro ferial de Madrid, en IFEMA, un hospital de campaña que pudiera albergar un número de pacientes que era indeterminado, que no sabíamos cuál podría ser, porque en ese momento la ola iba increciendo y todavía no había llegado a su pico máximo. En IFEMA eso fue un ejemplo porque pudimos ver a los profesionales, lógicamente, establecer los procedimientos como si estuvieran trabajando en un hospital, aunque lógicamente las naves de IFEMA pues no estuvieran diseñadas ni pensadas para ese tipo de actividad, pero se consiguió gracias a la colaboración de todos. Hoy somos más fuertes, hoy somos más resilientes, porque hemos aprendido de eso y hemos ofrecido soluciones que ya están para poder ser utilizadas en el caso de que fuera necesario.
Now I'm delighted to be able to introduce our absolutely splendid panel for this next session. Marie-Ange Sorakiao is MD for Resource Mobilisation of Private Sector Partnerships and Innovative Finance at Gavi, the Vaccine Alliance. John F. Ryan is Acting Deputy Director General for Health and Director of Public Health at the European Commission EIB2. Dr. Sumira Asma is Assistant Director General, Division of Data Analytics and Delivery for Impact at the World Health Organization. And Felicitas Riedel is Director of Innovation and Competitiveness Department at the European Investment Bank. Welcome to you all. Great to have you all with us. Now, just a reminder to our viewers that we do have a hashtag for this panel, Investing in Health for All. It's ready and waiting for you, so do please just jump on social media to share your thoughts throughout this conversation today. You can see it across the bottom of your screen there. It really does help us do a better job. We look forward to your comments. Now, though, let's get straight back to our panel. And our first question goes to Sumira. And Sumira, we're going to show you this map, which shows the fairly low scores given to most of the world in the Global Health Security Index. We're not prepared for the next pandemic, according to this map, are we?
Absolutely not. We are not yet prepared, but I think this map has truly unraveled the way we assess countries' capabilities to respond to outbreaks, emergencies, and even pandemics. As you see from the map very clearly, the countries that are green had even the highest excess mortality. So clearly, the metrics on which we base our investments and our ability to be better prepared is flawed and needs a renewal. And what we need is an independent metric system that will truly help countries to step up their capabilities. So WHO, along with countries and partners, has proposed an health emergency prevention index that has 3 components that looks at the ability to prevent, prepare, and the dynamic element to detect, notify, and respond very rapidly. We need all of these 3, and as you know that the international health regulations is also getting renewed after the pandemic reviews, and we are hoping that we will have a better and a robust metrics and a measurement system that will truly help countries step up every time an assessment is done.
It's certainly reassuring to hear about those developments being made. And let's talk about the lessons that were learnt then. Turning to John now, because Europe on that map apparently scoring fairly highly. And yet many of us here are in Europe and near to Europe are aware of staggering failings that took place during the pandemic. So what do you think we learnt from the pandemic, John?
Yes, thank you very much. What I think we learned from the pandemic is the importance of reinforcing our health systems in the longer term. Because, of course, one of the key lessons is that when you're in a pandemic, when something actually happens, it's already too late to do anything. So that's the key message I'd like to give, that it's really essential, I would say, to analyze each outbreak, whether it's Ebola outbreaks, whether it's Zika, whether it's avian flu, or in this case, COVID, in order to try and learn the key messages which we need to then feed back into our health systems investment. And of course, it's really also a mixture of different things, because we saw, for instance, that some of our member states who were well equipped in terms of PPE, for instance, or in terms of intensive care beds, were nevertheless found to be short of the qualified staff required to operate those beds. So even in a case where some of the metrics are in place, you may find yourself hostage to the fact that there would be other gaps which would then make the system inoperational. And one of, perhaps the best example I could give you of this situation, in addition to the ICU beds example, is the issue of global supply chains for pharmaceuticals. This is also an area which perhaps hasn't been mentioned so far, but where I really think we've got to invest and try and find solutions so that in the case of a future outbreak, we try and reinforce as many elements of the health system in advance.
Don't take your eye off that global supply chain crisis as part of pandemic preparedness. Marie-Ange, we want to come to you now and talk a little bit about inequality in pandemic preparedness. What really is at the root of that?
Well, I think we really feel that inequality of in pandemic preparedness comes primarily from the lack of health systems reaching the most vulnerable. What we have seen, and I think everywhere, from high-income countries like the US to fragile countries, is that unless, a health system can really reach the most vulnerable, we cannot really talk about equitable recovery, about equitable access. And I think that's why the focus actually has to start there. I think if there's one major change we need to think about is make sure consistently that there is this attention to the most vulnerable, because actually a health system that reaches the most vulnerable means that it reaches everyone. So that's a key one. Of course, what we have learned also from the COVID-19 pandemic is that to be able to respond fast, we also need to have a rapid and agile contingent financing that allow to have this surge in capacity in human resources that John was just mentioning, to be able to, give the added capacity, but also, to start responding, to start procuring the products that are much needed. And I think from there, we have to say that EIB has been an incredible partner, because they help us, as soon as we realize that, really push the frontiers of innovative finance to help address many of these constraints. Actually, coming back to supply chain, indeed, I think in terms of global supply chain, it's fair to say that we have relied a lot on global supply chain for being vaccine, test, or treatment for a long time. And what we saw during the pandemic is that this global supply chain was not working anymore because of export restriction, bans, and other difficulties. And I think here, that's where we have to work together. And we started working with EIB, WHO, on thinking more about supply resilience or security, and actually, regionalizing the vaccine manufacturing, for example, because typically vaccines have a long lead time to development and have a very complex and technological process. And so in a sense, we do have to think to other complements to what used to be before global supply chain.
Once again, supply chain being something to focus our attention on, and just continuing the theme of equality and inequality around those supplies as well. Felicitas, let's come to you, because during the pandemic we heard a lot about the richer world hogging health resources to the detriment of the rest of the world. Just how bad is that issue?
I think it's definitely something that needs to be taken very seriously, and therefore equity of access is something that, together with a big network of partners, we try to tackle, and therefore collaboration not only with the WHO, but of course also with the European Commission, but also with stakeholders such as Gavi, Bill and Melinda Gates Foundation, Wellcome Trust. We really try to engage and support the setup of capacities also in low and middle income countries. As clearly as stated before, it was evident during the crisis that those who had access to manufacturing facilities were the ones first served. So we need to make sure that there is proximity as well available, but this requires investments in an entire ecosystem. So you also need to strengthen regulatory environment, for example. You need to make sure that you don't just focus on availability of a certain technology or one type of vaccine, but that you really create a sustainable ecosystem.
As part of this conversation now, we'd like to show you all a short clip, because at Project Syndicate's Back to Health event last year, the former Rwandan health official and health minister, Professor Agnes Binagwaho, had this to say about global responses to the pandemic.
So, follow the science. We know the evidence-based intervention. We didn't invent them, we apply them. We see if we have to do a lockdown, this is what we have to do to protect the poor. And the government took its responsibility and make itself ready. All countries should have done that.
Samira, follow the science. Now, we've all heard that phrase before, but to health professionals like you, what does it mean?
Following science and data is fundamental to any public health action locally and globally. And what the pandemic has taught us is that the data and health information systems architecture is very fragmented. And you had the question around inequalities. And if we are truly serious about closing the inequality gap, we need to know where the gaps are. What we have seen during the pandemic, even counting deaths, which is a fact of life, we were unable to do that accurately. The reason is that even before the pandemic, 6 out of 10 deaths around the world and 9 out of 10 deaths in Africa were not registered. And more than 70 countries in the world today do not produce accurate causes of death. And we also know that good civil registration and vital statistics is fundamental to good governance and to also keep us on track of the Sustainable Development Goals. So one area that we all must come together and focus on is to strengthen data and health information systems is going to be extremely critical and urgent.
And picking up on Rwanda once again, because those comments we got from the Health Minister, Professor Agnes Binagwaho, at last year's event, Marie-Ange, as we saw with Rwanda, poorer countries are very capable of coming up with solutions as well.
Yes, I mean, look, I think Agnes was in the Gavi board, so I can only, agree to what she's saying. I mean, look, I think countries, we shouldn't generalize, because a lot of countries actually have built their health system over time, particularly the immunization system that is actually the bedrock of health system in general. And Rwanda, for example, has been able indeed to adopt a very thorough systematic approach. Most importantly, to come back to what has been said in terms of data, in terms of access to innovation, one of the fundamentals I think that we have seen during the pandemic, but we started before the pandemic, is really being able also to bring in different type of partners, to have a multi-stakeholder and bring, for example, the private sector that has the expertise to help. Because, for example, in the case of immunization, of course, you have vaccine, but you have vaccination, which is actually the whole process of bringing the shot into arm. And there we have made enormous innovation with the private sector in distributing vaccine rapidly. For example, in Rwanda, we piloted drone delivery of vaccines before the pandemic, and actually with the pandemic, it went 24/7. And this then was replicated in Ghana and now in other African countries. So I think one of the key lessons also is really to build on this multi-stakeholder and bring different type of partners, because it's not just about health experts, but really bringing the people that can help also innovate the system so that we are ready faster. What the pandemic showed is that the health system was not fast enough to reply. And in a sense, we do need to have that addition, and that can come also by partnering. So I think that's a really important point, both on technology, but also on supply chain, because it remains important within countries to have the best supply chain and working, for example, I saw earlier the vice president of EIB talking about the deliveries of COVAX. It was made possible also by partnership like UPS and other major logistics companies.
Logistics companies, innovators, but funding as well, that is key, as you pointed out. They're like these multilateral banking organisations. Felicitas, as with most major problems, isn't the solution simply just to invest in areas of weakness?
I think I would say it depends. Of course, funding is essential, but you need to ensure that the funding is put into sustainable projects. So therefore, it's very important to make sure that you figure out what does it take to ensure that, for instance, this hospital that is being supported also has the right access to qualified staff, has access to clean water, has access to the necessary consumables. So it takes a lot more than purely making available a certain amount of funding, that you need to create the ecosystem around it. And this is what EIB, also with the help of our partners, we try to ensure with our investments, that not only we follow the principle of equity of access, but also to ensure that we invest sustainable projects that really deliver the economic impact that we search for.
And when we think about multilateralism, whether it be banking or any other type of institution, John, there are obviously so many layers and stakeholders involved. With government, for example, we've got local, regional, national, intergovernmental. How do we ensure that they basically stop stepping on each other's toes and collaborate properly?
Yes, there is a definite effort at the moment going on internationally to learn lessons from COVID, and also to make the situation more sustainable for the future. And I mean, I'm looking at the moment at, for example, the G20 process, where there's an interface being created with the help of the World Health Organization between the finance and health ministries, which will be a structural cooperation between those two ministries within G20, where preparedness and investment in health systems will go hand in hand with the finance colleagues. So I think that's perhaps a good practice example where countries could actually learn a lesson from the G20 and apply at this national level the interface, a permanent interface between health and finance systems. Secondly, the G7 is also investing very heavily in time and political effort, I would say, in pandemic preparedness, also trying to learn lessons from COVID. there is a reform going on of the international health regulations, which I think showed their limitations in terms of how countries had invested in core capacities for surveillance and response. That's an ongoing process in Geneva at the moment. And of course, the pandemic treaty, which is also intended to try and underpin a constant attention to pandemic preparedness worldwide. This is a binding international instrument. And finally, then, just to mention the UN Pandemic Preparedness Fund, which is also being put on the road at the moment with substantial investment from the European Union and from other countries around the world. So I think compared with previous outbreaks, compared with previous events, I do see a change in respect to the response to COVID, because people are actually conscious now of the impact on society that a health event can have, health event of this nature can have. And therefore, there are lessons being learned, and there are measures being put in place to make societies more resilient. Societies as a whole, and not just the health systems. I mean, the health systems are part of society, and that's really a key lesson from the COVID outbreak, that societies are vulnerable if their health systems are vulnerable.
Let's stay with this topic of funding and financing, shall we? We've got another graph to show you here, and we'll come back to you, Felicitas, because this graph shows surging debt levels. Poorer countries, when you consider just the debt burden they have, it would seem to imply they don't have the spare money to prepare.
That's indeed.
Coming to you. Yep.
Yeah, I think that's indeed quite a shocking graph that you show, and also reflects, unfortunately, the reality that we see. But therefore, it's even more important to ensure that whatever funding is available, that you first of all try to leverage whatever is possible. So therefore, if you have grant funding available, that you try to stretch it and to leverage it with additional loan products, for example. And that's why it's so important that all stakeholders really work together to make sure that the scarce resources are invested in the most optimal way, but equally that you really do invest in ecosystems that can become sustainable in the long run.
Let's talk a little bit about political will, of course, as well, because that is key in this puzzle. And John, coming back to you with regards to Europe, because it could be argued that some politicians seem to have moved on to other issues already.
No, I think it's quite normal that politicians move on. That's their job. They have to be on top of different crises at different times. And we're all, of course, facing the Ukraine situation at the moment, at least on the European Union level. But that's why I said it's so important that we do learn lessons and embed those lessons from COVID. And I think politicians have recognized the significance of the COVID event and the importance of improving our health systems as a result. We have actually amended our legislation on health threats in the European Union. And this week in the European Parliament in Strasbourg, we'll be signing off a new strengthened health security framework for the European Union. We have also strengthened our agencies, the European Medicines Agency, the European Centre for Disease Prevention and Control, and we have established a mechanism for the joint procurement and development of medical countermeasures like vaccines. So those three examples I gave you, where our legislative framework has been strengthened, our agencies have been strengthened, and our procurement of medical countermeasures have been strengthened. These are examples of long-term approaches which are based in legislation. And even if the crisis moves on and we move on to another subject, the legislative changes make sure that the lessons learned have been embedded in our system in Europe. And that's what we're also trying to do at the international level by strengthening the international health regulations, creating the pandemic treaty, and setting up the international funds to deal with any future crisis.
And let's talk then a little bit away from funding, more towards skills then. Marie-Ange touched on this previously with innovators, but Samira, I want to come to you because the pandemic responses in the West show that the problem isn't just about finances, but it's also about expertise, skills, technologies, and other types of shortfalls.
Absolutely. I just want to bring us back to the Sustainable Development Goals. Today, the world is going at about a quarter of pace it needs to reach the goals by 2030. And development is at the center, and health is a part of integral part of SDGs. And if we keep this pace with business as usual, we will continue to be insufficiently prepared. So I think the response to this cycle, we need to take a holistic view. Starting from this dialogue that we are having, we must accelerate progress. And we can do that by using the ready-to-scale innovations that pandemic has brought to the forefront. We have seen that, and that needs to be scaled up. The other area is innovative financing and impact investing, going to be extremely crucial for countries to have a predictable models of financing, which also improves health as well as improves the economy. So a better understanding of the financial ecosystem is going to be very important to advance public health. And third, already highlighted, is the partnerships amongst multilateral, multi-stakeholders within countries, and most importantly, the public-private partnerships are going to be important because public sector does not often innovate. We need to really bring in the innovations in the digital technology sphere and other spheres to, again, move rapidly to close the gaps and to accelerate progress. But these are the means, but we really need a renewed approach to global public health, where we address the root causes. We use some of the levers that we have not used, like taxing commercial determinants of health. But most importantly is also to strengthen primary health care. Extremely important. We can be better prepared without underlying primary health care and strong, resilient health systems.
On that note,
that will give us the ability to respond rapidly to outbreaks before they become epidemics or pandemics. And we have seen that in Universal Health Preparedness Review. This is another multilateral member state-led initiative that Dr. Tedros announced in 2020. And it is a new way of multilateralism where countries come together on a platform based on trust and transparency. 4 countries have piloted Universal Health Preparedness Review. That is Central African Republic, Iraq, Thailand, and Portugal. We have seen
on that note, Samira, we'll just have to pause you there because we would like to, whilst we have time, bring this clip of Prime Minister of Barbados, Mia Mottley.
I want to commend the International Monetary Fund for their rapid financing mechanism at the beginning of the pandemic crisis, and soon for the Resilience and Sustainability Trust that is about to be launched. That is the first recognition that middle-income countries should be able to access funding irrespective of per capita income, but dependent on climate vulnerability. And we say that for those who commend it to the International Bank for Reconstruction and Development, do not simply commend it for countries following a disaster, but let us do it for countries before the disaster.
Marie-Ange, I want to come to you now because Prime Minister Mottley wants international organisations to fund developing countries' resilience before disasters, not after them. Do you think that is happening?
I think that's where we are going now. I think you heard my other colleagues, in a sense now, thanks to drawing from the lessons of the pandemic, we have put in place mechanisms and also financing mechanisms that can be called upon immediately at the very beginning. But the main point of the Prime Minister is to say, basically, let's build now strong systems so that by the time the shock arrives, we are better prepared. So I think definitely, in a sense, building health systems, having mechanisms in place, and we heard John talked about indeed at the G20 having health and finance ministers talk to each other so that they are better aware, finance ministers, of the needs and what needs to happen before that. having, institutions like EIB ready indeed to put in place and to finance together, and some of the risks like we have been doing is crucial. Basically, the lesson here is that you shouldn't wait for the disaster to happen because it's too late. You have basically, that's the whole meaning of preparedness, right? You basically have to be ready before, and I want to come back to the word that has been used several times. I think here what we are trying to do is really have an ecosystem that can respond rapidly, agile, flexible, and in all the parts that are needed, being in the system side, being in the regulatory side, being in the financing side, being in the innovation side, because where we have to be actually optimistic is that all these elements exist. It's really about bringing them to the next level. And I think where we have what's very important, you were talking about political will earlier. Actually, now is the best moment because we are still in the pandemic. Some say in the aftermath, but we are still in the pandemic. So the memory is very fresh. And I think it's that in that moment that we have to use and make sure that the mechanisms that were developed can be made sustainable, can be made more, long-term, if I may say. And we heard some of the example at the European Union, but also in Africa and in other regions that have taken similar steps. It's really making sure that we give them the opportunity to scale up, but to scale up rapidly. So I do think that we have all the elements, but it's continuing that momentum, but that acceleration, because speed is really of the essence here.
And talking about financial mechanisms, John, coming to you, because Mia Motley's proposed debt for health swaps, pandemic protection bonds, etc. Do you think Europe's paying attention?
Yes, Europe is paying attention. In fact, I can say to you that before the end of the year, the European Commission will be coming out with a new proposal for a global health strategy, which will go actually beyond the COVID lessons learned, which we've been talking about so far. And we'll look at, for example, the topics of strengthening health systems, which Director General Tedros was talking about in the introductory session, based on advancing universal health coverage. We'll also be looking at inequalities of health, global inequalities in health, taking over the thing about enhancing resilience and linking health systems together more effectively in one health approach, because many of the outbreaks that we're facing are originating in the zoonotic world, and this is going to continue over time. So I think it's really important that we do have a linked up one health system which takes account of food security, animal health and human health together. This goes beyond the COVID lessons learned exercise, and we hope that this European Commission initiative before the end of the year will also kickstart a new attention to global health challenges in the coming years.
Unfortunately, we are just out of time for this conversation, but it has been a great one. Thank you so much to all our panellists, Marie-Ange, John, Samira and Felicitas, for taking part. Let's now get the thoughts of Sandra Gallina, European Commission Director General for Health and Food Safety, to wrap up this session.
There's no doubt that the COVID-19 pandemic has hit our health systems hard. It has disrupted our health service delivery and increased mortality in the EU. Now, as we prepare for what may yet be a challenging autumn and winter, we must make sure that we are not in that position again. We now have political agreement on the new EU regulation on serious cross-border health threats. We have also the pharmaceutical strategy for Europe, which is another building block in our health union. As well as seeking to ensure that the EU has a sustainable supply of affordable medicines and keep the European pharmaceutical industry as an innovator and world leader, this strategy will offer concrete solutions, making a practical difference to citizens and to health systems. The undertaking will require continuous increased investments in facilities, in supplies, in new care models, such as telemedicine and, for instance, investment in the health workforce, which is extremely needed. Harnessing the huge advances in the use of telemedicine during the pandemic has shown that we can make wider use of digital and of digital health solutions in all care settings. We also need to build a well-staffed, well-trained health workforce, able to address the 21st century challenges. We cannot do this alone. We need to work with major partners in the health sector and beyond. Major partners like you, the European Investment Bank. The EIB has already provided extremely valuable support for the development of COVID-19 vaccines. You've been a key ally in our daily work, in the efforts to tackle the pandemic globally, for example, through your support for COVAX. I'm trying to look forward together with you and trying to build back better through the 25 national recovery and resilience plans that have been approved so far. The Recovery and Resilience Facility includes more than 40 billion euros for investments in health. This may sound like a healthy sum, but you know, the needs are huge, are immense, and we need large investment pools. And these gaps of investment caused by years of underinvestment mean that we are very far from having enough money. This is where you, the EIB, and all the fellow investors can come into investing even more into health systems. There's no competition here. There is not a crowded space, I would say. We need to invest in resilient health systems, and you know, this investment is important to have equal societies and stronger economies. This type of investment always pays back.
Well, don't go away. We will be back shortly looking at how we can build an effectively funded global alliance to fight and treat preventable infectious diseases. This is Investing in Health for All, brought to you by Project Syndicate. See you in a minute.
March 2020, COVID-19 came as a shock. Suddenly, patients flooded hospitals and death rates skyrocketed. Overnight, economies stalled and the world went into lockdown. 9 months later, BioNTech, with finance from the European Investment Bank, released the first messenger RNA vaccine to tackle the virus. Vaccines are key to overcome the pandemic, but they need to reach everybody, everywhere. This is why we support COVAX, the global initiative to provide equitable access to vaccines. Together with other European institutions, we are also boosting Africa's capacity to manufacture its own vaccines.
This funding is going to reinforce the health security in Africa. It would create jobs, develop capacities in terms of know-how and workforce, while bringing new technology and helping Africa to be self-sustainable when it comes to vaccine manufacturing.
We are ready to support the expansion of mRNA technology, which was used successfully in COVID vaccines, to develop new vaccines that eradicate malaria. And we continue to work to strengthen healthcare systems in lower-income countries, like the National Health Laboratory of Rwanda.
It's going to be a huge boost to our efforts into improving lab, looking at specialized testing like sequencing, like research.
In the Western Balkans, together with other European institutions, we are building and modernizing hospitals with state-of-the-art medical equipment.
Za radiologije koju smo sa novim mašinama dograđivali, prepravljali postojeći prostor koji je pravljen tamo negde posle ili u vreme drugog svjetskog rata.
In Morocco, we provide finance to support healthcare infrastructure that improves people's lives.
Pour moi, l'hôpital de Salé est un hôpital unique de la région parce qu'il est très spacieux, il est moderne, il est très bien équipé et il est très accessible à la population.
From 2017 to 2021, the EIB has invested 17.8 billion euros in the health and life science sectors. In 2021 alone, more than 780 million people around the world are benefiting from our healthcare investments. COVID-19 is a wake-up call. It reminds us that health is a global priority. At the EIB, we continue to ensure that countries are ready to respond better and faster to future health challenges.
Hello there and welcome back to Investing in Health for All, brought to you by Project Syndicate. I'm Rosanna Lockwood. Now, the race against disease, that's the name of our second session of the day, because COVID is, of course, not the only challenge the world faces. While new diseases may lie on the horizon, the old ones are always with us, killing millions and devastating the livelihoods of millions more. The poor, of course, are hardest hit, and they suffer too from unequal access to new drugs, diagnostics, and new models of care.
Today, as the world responds to the pandemic, a very big moment. The UK is the first Western country to start vaccinating people against the coronavirus.
The U.S. declaring a public health emergency over the monkeypox outbreak across the country.
Malaria is an ancient curse. Vaccine trials here in Malawi and elsewhere have proved successful. For the first time, there is hope they can live without it.
And we will be speaking to our panel shortly. A reminder first, though, that we do want to hear from you too throughout this conversation. So skip over to your socials and use the hashtag #InvestingInHealthForAll. It's along the bottom of your screen now. And now opening this session, here's Signe Razzo, Acting Director General of DG Research and Innovation.
The EU has and continues to be at the forefront of supporting research and innovation to prevent and tackle health threats. Since 2007, we had already invested over €4 billion in infectious diseases research and innovation. Then COVID-19 came and changed the whole research and innovation landscape. We mobilized almost €1 billion for COVID-19 to develop new vaccines, therapeutics and diagnostics, as well as research into the socio-economic aspects of the pandemic. We used all our available financial tools to mobilize such funding, including through the EIB with its loan to BioNTech for their successful COVID-19 vaccine. COVID-19 has confirmed what we already knew, that planning and investing in R&I before a crisis occurs is crucial to be able to respond to health threats rapidly and effectively. That is why we have not only supported research to tackle the pandemic in the short term, but we have invested into R&I for preparedness and response to outbreaks. We have established key EU-wide clinical trials network for vaccines and therapeutics that can be rapidly mobilized when an outbreak occurs. These are now used to tackle the monkeypox outbreak. Our grants now include specific data sharing clauses, and we have established platforms to ensure that scientific knowledge can be rapidly shared in case of public health emergencies. COVID-19 has also shown how crucial it is to collaborate with partners. We have established and invested in partnerships such as the Innovative Health Initiative and the Global Health Clinical Trials Partnership. These partnerships will develop new health technologies and medical countermeasures to tackle pressing health challenges. In September, in partnership with Coalition for Epidemic Preparedness Innovations, we launched a new call for funding to advance the development of vaccines against Rift Valley fever, for which no vaccines are currently approved for human use. Rift Valley fever illustrates well how the health of humans animals and our ecosystems are interdependent, and why we need a One Health approach to look at the causes of infectious diseases, as well as to develop the necessary medical countermeasure to tackle them. Through our Horizon Europe program and via our partnerships and initiatives, we will continue to invest in infectious disease R&I, ensuring that when the next pandemic hits, we have the methods and tools to tackle it.
And now just a word from someone at the sharp end of the vaccine challenge, Mary Lou Valdez of the Pan American Health Organization.
In 2021 alone, more than 2.7 million children younger than 1 year of age in the Americas, representing almost 20% of the target population, did not receive all their vaccine doses, leaving them susceptible to diseases such as polio, tetanus, measles, and diphtheria. New evidence of these types of immunization gaps is emerging every day. This confluence of epidemics, outbreaks, and declining vaccination rates is occurring while health services in all countries have been deeply impacted by the COVID-19 pandemic. And we know the pandemic is not over, and countries are still grappling with its effects.
So many important voices. Now let me introduce our next panel. Jeremy Farrar is Director of the Wellcome Trust. Barbara Christie-Jens is Head of the Combating Diseases Unit and the Directorate General for Research and Innovation at the European Commission. Next up we have Wolfgang Philipp, who's Acting Director of Health Emergency Preparedness and Response Authority at the European Commission, and Dr. John Reeder, Director of Special Programme for the Research and Training in Tropical Diseases and Director of the Department for Research for Health. Welcome to all of you, and let's begin this discussion by showing you this clip.
Well, New York has declared a state of emergency in response to the polio virus. Polio has been detected in sewage samples from 4 counties in the New York metropolitan area and the city itself.
Look, John, infectious disease, as you well know, it's an intractable problem. Once one is out the way for members of the public, it feels like a new one rears its head. Polio, monkeypox. Where would you say we're at in a sense of knowing how to respond quickly to these things?
I think we've certainly learned a lot, and the last epidemic has shown a lot. But I think where we've failed to learn is that actually investing more in global research capacity will help all of us. And I was recently reading a report out of the WHO Global Health R&D Observatory, and many of you are around in the turn of the century, 20 years ago now, will have heard the discussion about the 1090 gap, where only around 10% of global health research funding goes on the diseases that affect 90% of the world's population. And I'm afraid we've made no progress on this. And I think underlying a lot of the problem we have today is we're talking about truly global health problems, but we are still not investing to make them truly global health responses.
And investing is a topic we keep coming back to today and will do as part of this conversation. But with regards to that clip we just showed regarding a disease like polio, which many would consider an old disease, why are we seeing those return, Wolfgang?
It's good. It's a good question. I think there's a number of underlying problems that we have seen also for COVID. I mean, we're still in a COVID pandemic. I think it's a kind of a repetitive list of lessons that we always reflect on once epidemics or pandemics are over. Just to put it in a nutshell, I mean, we always see that there is a certain level of underpreparedness. There's a certain level of under-implementation of preparedness plans. There's a certain level of under-investments into healthcare systems, into search capacities. There is a certain level of market failures, lack of medical countermeasures in places where they're needed. And obviously, another point is also that what was mentioned already and also in the other sessions is that there is a certain level of incoherent global health, security, research and innovation agenda. So basically, I would say the fundamental focus should be on a structural problem. And that is a bias more towards financing response instead of preparedness and prevention. There's good reasons for it, low probability of revenues, low probability of events, but nevertheless, I think what COVID has shown us, what we see now with monkeypox, and luckily we are lucky to have a vaccine that works here, is an underfunding of preparedness and prevention activities that definitely needs to be corrected.
An incoherence you mentioned there, an inequity, that's the other thing that we keep picking up on today. Jeremy, coming to you now, because the richer world, we know, races against disease much more quickly. It has better resources to do so, but we are continuously told that as long as outbreaks happen in the developing world, no one is going to be safe.
Yeah, we are repeatedly told that. I mean, if the lessons of the last 2 years don't change that perception, I don't know what is going to. These are not random events. The idea that these should be shocking us or they're coming from somewhere which we've never guessed or couldn't anticipate is something we've got to change the narrative of. If you just look back in the last 20 years, John was talking about earlier, to the turn of the century, and just go through the number of epidemics or regional and global pandemics that the world has faced. Nipah virus in Malaysia, 1999, SARS-1 in Southeast Asia, but spreading to Europe and North America. Of course, COVID, Ebola, Zika, the influenza pandemic of 2009, which thankfully wasn't very severe. The continued pandemic of drug-resistant infections, and of course, HIV, TB, malaria, the growing threat of dengue. I mean, it's a litany. It's an absolute litany. And when you talk about things like antimicrobial drug resistance, that's a global phenomena. And it's not just about infections. You can't conduct safe surgery. You can't have safe childbirth. You can't prevent infections from leading people needing intensive care or dying after trauma or after surgery. So we're talking about really the whole of modern medicine here. And yet, as a world, we're not prepared to invest. And the title of this session is Investing, which I think is a great title, in health for all. And if we just kept those three words together, invest, health, and all together, and we lived that mantra, we would do an awful lot better in the next 20 years than we have done in the last 20.
Yeah, you make it sound so simple. It's a good idea to hold on to those three words. Jeremy, Jeremy mentioned it, and antimicrobial drug resistance. Speaking of that, something we want to come to you on. How much does it undo all the developments that have been made, for example, the progress against malaria?
I think antimicrobial resistance, as Jeremy alluded to, is a serious problem, probably underestimated in the sense, maybe not from the scientific perspective, but certainly from a health systems perspective. And it needs to be tackled by investing in research more, but in a coordinated way. And also, as John was mentioning, investing in building the capacities. Because we need the antimicrobial resistance is global, and we need to tackle it in a global way. So this is also what the European Commission is doing, notably through the European and developing countries clinical trials partnership that focuses on sub-Saharan Africa, that has now integrated the fight against antimicrobial resistance more explicitly in its research agenda, and whereby we will not only support the research, but also building the capacity to get the products finally to the market. So, for example, building regulatory capacity and also building the capacity to conduct the research itself in the places where it matters, for example, in sub-Saharan Africa.
We want to show you another clip now to move this conversation on.
Pfizer executives are calling it one of the biggest medical breakthroughs in the past 100 years. A COVID vaccine developed in just 6 months, 90% effective in the group of drug trial volunteers who were known to be infected, now expecting to seek emergency FDA approval this month.
The amounts of lives that can be spared, with 1,000 people dying in the U.S. alone, many more in the world right now, every day. It's a great day, as I said, not only for science, but for humanity.
Barbara, coming back to you briefly on this one, even Dr. Tedros mentioned at the beginning of our sessions today, we came up with that vaccine for COVID so quickly. Does that mean we could do the same again, but faster?
We came up with that vaccine so quickly, among others, because we had invested in the research on mRNA vaccines already for quite a few years. So it pays off to invest for the future. Then we did it so quickly by using different financial instruments, notably the blending instrument we have with the EIB. And then I think insights have been gathered to what are the elements in this process of developing the vaccine, manufacturing it, distributing it, that should lead to going more quickly. And this is also part of the agenda of CEPI, the Coalition for Epidemic Preparedness Innovation. That is, and we, together with other, are funding CEPI for the support and development of vaccines against infectious threats.
And the vaccine, just one piece of the puzzle, of course, within the COVID pandemic, but the major piece. How else did we go about beating this disease? John, I'll come to you on that.
Look, I reflect exactly as has been seen. I think the previous investment for a strong research structure in the countries paid off phenomenally well. But I think we've also got to remember the fact that we made this vaccine extremely quickly. And I think there are ways we can learn lessons, and we should be looking at how we can address other global health problems. But remember that compared to, I remember seeing figures of vaccine rates of 80% in the UK. There were 3 to 4% in countries in Africa at that time. So the whole problem, as you say, is greater than simply developing the vaccine. It's also about giving equitable access to the products we develop and thinking that through from the very beginning.
Seem to be one of the major lessons learned. And the other one that we keep hearing a lot about today is innovators and innovation in the health preparedness space. Coming to you, John, Wolfgang rather, how do we drive that type of innovation in the search for new treatments?
So there is, I think, coming out of some of the lessons that we have seen in the COVID pandemic, was just mentioned, de-risking of investments to bring really vaccines to the market. I think that is one of the elements that we have learned. I would just like to mention here an approach that the EU has been choosing, and that is the establishment of the Health Emergency Preparedness and Response Authority, which is a Commission division or Director General. But the idea is to have a central body that looks at the prevention, the detection, and rapid response to health emergencies of a certain scale. So we're trying through a budget which is earmarked around 6 billion for 6 years, 6 billion euros. We are trying to make sure that investments are going into development of vaccines, of drugs, of precursors of drugs, of precursors of vaccines, of further development of technology for vaccines, drugs, but also for diagnostics. At the end of the day, to make sure that these products are available even faster than what we have seen now. Ideally, that we detect earlier what is happening, that we have a good assessment of the potential of the threat, and then really can act cooperatively, ideally at a global level, to make sure that products are produced at scale and delivered where they're needed. So we are investing quite a lot of money. We have established a new authority here, which is not a competitive part of new research funding, but which has really a very specific mission, and that is to make sure that we are faster in detecting and responding to health emergencies.
Jeremy, interested to know from you, are there alternatives to the traditional commercial model? Is that what large funders like you are trying to build?
Yeah, there are. I would pay tribute to the European Commission, and Horizon Europe was mentioned, and I sincerely hope that differences politically can be put aside and the UK and Europe can continue to work together as part of Horizon. We do need more innovative financing for this. Firstly, I would say that we must not underestimate the long-term nature of research and innovation. And it's already been mentioned, but We talk about the mRNA vaccines for COVID being developed in a year. As Barbara said, they've been invested in as a basic research for 10, 20 years. And it's been that investment over decades that led to the fact that we could make vaccines within 12 months. We need to appreciate that the private sector's got a crucial role to play, and tribute to all of the private sector that you've already highlighted in making the vaccines. But if we want vaccines, we want therapeutics, we want tests for which there's no commercial model, or indeed antibiotics to treat new infections, then we've got to appreciate that the public sector and philanthropy, but the public sector is at scale, has got to invest in those and almost demand and to expect and then be willing to invest and pay for those products for which at the moment there may be no commercial driver. And I think some of the innovative financing, for instance, the subscription model that's being tried in Sweden and in the UK at the moment for antibiotics, where despite low volumes maybe you'll never use those drugs, but the companies or the developers would be paid for them even though the government may not use them within their health system. Those sort of innovative financing models are what we need in order to pull through the investments that come out of the public and the private sector investment in the basic science and in the early development.
Well, Jeremy, I'm going to keep you there a second. Let's take a look now at this graph, which highlights one of the issues at hand. For example, why does antimicrobial research and development just attract so little money? It's less than 5%, as you can see here, of venture capital investment in pharmaceutical R&D. Why is that?
Well, firstly, and this is no excuse, and I'm not trying to defend the scientists here, but it is tough. It's hard. And it's also because I think we have not valued this class of essential treatments and indeed vaccines highly enough. We've regarded antibiotics as something that are as cheap as chips. They're like Smarties. You can buy them very cheaply in many parts of the world. And it's been a volume thing rather than a quality and a valued thing. We haven't looked after these as well as we could and should have done, which means drug resistance comes sooner. As Barbara said, the rise of antimicrobial resistance is about infections, but it's also about the whole of modern medicine. And if we lose this class of drugs, or if tuberculosis becomes more resistant, or indeed malaria becomes more resistant, then we will have growing pandemics of these diseases, which we really should be able to combat. So I think it's going to require a different model between the public and the private sector. And yes, we're going to have to pay companies in a different way in order to incentivize the development of these essential drugs for the future. And by doing so, we can also demand that they are made accessible to parts of the world without the money that's available in Europe, North America, etc. And so there's a win-win here. It can improve access at the same time as improve availability.
Thanks for that. But speaking of the public sector, then I want to pose something to Barbara based off your comments, because profits for antibiotics aren't actually realised typically until the 23rd year after the first investments are made in preclinical research. So a lot of investors would consider that to be slow. Why is it so slow to reap those returns?
Well, as Jeremy already alluded to, there are two things. One is that there's a high risk of failure in the development of the right antimicrobial of antibiotics. We know that under the Innovative Medicines Initiative, we've been funding a large program that would support the development of antibiotics, new antibiotics. And after 10 or more years, still there's nothing on the horizon. So it's just high risk. And that's why also we are working together, among others, with the EIB to have a combination of push and pull incentives for the development, to stimulate the development of these new antimicrobials that are so much needed. And I just wanted to point out that I think with WHO, we're doing a great job in defining target product profiles so that what is being developed can be used in those places where it is needed. So certainly for the new antimicrobials, like for the new vaccines, we should make sure that what is developed can be used, whether it's in Latin America, Asia, Europe, North America, or Sub-Saharan Africa.
John, coming to you, could you speak to us a little bit about some of the scientific hurdles involved in the development of these antimicrobials?
Yeah, I mean, the first thing is like most biological organisms, they're really quite clever and really quite complex, and they've been pushed towards an evolutionary state of dodging around the tools we have in front of us. So there are kind of two aspects here. I mean, of course, we need to continue investment and research onto these basic areas of antibiotics. And we see that this isn't really fitting with the current model of big pharma to do this. That, you know, the very long lag of realizing profits against quite high investment in this. So I think we really need to be thinking of alternate models. And one of the things that I've been very impressed with over the last decade have been the rise of the product development partnerships, which have been focusing on other diseases which have no market, many of the neglected tropical diseases, and yet being able to form partnerships which drive production of new therapeutics and great success of fexinidazole for sleeping sickness by DNDi last year, for example, at costs that can be afforded. So I think we need to think about the model and how we involve pharma, but not just rely on them to use which is not a model fit for purpose in this case. And just an additional, comment on that is that there are things we can do immediately, and simply working with countries so they can introduce better stewardship or basic implementation research about use of antibiotics as well, at least slows down the progress in some of the countries. But ironically, it tends to be the higher income countries that have been using more intensively antibiotics and using the more recent antibiotics at much higher volumes that are now facing these big problems.
Does pharma have a role to play then in that usage in developed countries of antibiotics, as you mentioned?
It's got to, but I guess, we have the dilemma that pharma is there to sell antibiotics, so it's very hard to say, well, discourage people from buying the product. But on the other hand, I think they realize the responsibility they have for reasonable use of antibiotics. But, there are things like unregulated markets in antibiotics, and it really needs to be an inclusive approach to this. But in the end, it is about having new products as well as conserving the ones that we have and thinking of smart ways in which we can bring them to market faster, bring them to market cheaper, and make them affordable so we have equity of use.
Interesting to know how all these stakeholders can work together, though. Now, we want to bring you this headline to take a look at now. Barbara, we'll come to you on this. Indeed, on the brink of an AI, an artificial intelligence revolution in speeding up research in development. That was a headline that Bloomberg has reported. You see there, drug discovery is about to go faster thanks to artificial intelligence. Barbara, have you had any experience of seeing this yourself?
Not specifically the example that you're mentioning, but in general, we know that artificial intelligence has a high potential, notably for drug discovery, also to do quicker compound scanning and seeing what would work. And this has been, for example, used in a project that we funded related to COVID-19. I think in general, there are a lot of innovative technologies that will help us go faster, be more accurate. And to mention one is, for example, also virtual reality. So that a lot of the virtual reality does not relate to compound development as such, but we need to look at the total chain. One thing is to develop the product, the medical countermeasure. The other thing is to having it being used and in an appropriate way in an appropriate setting. So I think we are lucky in a way that these new technologies have been developed and that they will be supportive of our work. Though we also need to be careful that, for example, in the use of artificial intelligence, we have strong validation processes to make sure that what is being automated, if I so say, does detect what should be detected.
Absolutely. It's just one of those topics that's ripe for discovery, but also regulation, some would argue. Now, let's go back to some of these funding mechanisms. Wolfgang, I'd like to come to you on this because you've got government seed funding, pre-purchase agreements, things like that, necessary incentives for pharmaceutical companies. But in layman's terms, how are these helping? If you had just a member of the public coming up to you on the street and asking, what is the EU doing to help, what would you be able to say?
It's a very complicated question. I think really to break it down in 1 minute. But at the end of the day, what the EU is doing, the EU is supporting research into products, into medicines, into diagnostics, into vaccines that might not be developed by a business operator, simply for the very simple reason that there is no market for that company to serve afterwards. But on the other hand, there is a public interest, and that brings us back. An example would be the development of the Ebola vaccines, which are on the market. The Commission has been supporting this, also with 160 million. Malaria vaccine, that was done also through a blended financing, which is perhaps not a term that everybody understands, but at the end of the day, it's the public and the private sector and foundations working together to really pull product developments through the pipeline and bring it to the market. So the EU is very much investing. We at HERA, we are also looking at this in certain areas, like for antibiotics and other products, antivirals, vaccines for pathogens that have a pandemic potential, but where there is no market at the moment. So we are trying to also, in cooperation with the EIB, they have a great track record in this, in developing new financial vehicles to put this forward. So in a nutshell, basically, we are trying to invest into protecting our health in the future from threats that are inevitably there, born normally out of viruses, bacteria, and other origins.
Jeremy, speaking a little bit about some type of actions and proposals and whether or not they could eliminate incentives for future drug development, how much of a concern is that? Does it create an even bigger issue?
No, I'm not quite sure what you mean by your question. I don't think so. No, I mean, the sums we've heard from Wolfgang and from Barbara, and John knows them very well, and what we do at Wellcome. I mean, they sound big numbers, and they are. But if you compare those numbers to what a number of pharmaceutical companies might, for instance, allocate in investing for a new cancer drug, which is critical. We all, cancer drugs are just as important, or for a new drug for an autoimmune disease. I mean, the amount of money we're talking about here for malaria, for tuberculosis, for neglected tropical diseases John was talking about, or emerging pathogens, the amount of money we're talking about in the system is tiny. I also think we need to work harder at learning the other lessons from COVID, which was that we can do things quicker and cheaper, but with the same quality. And the same regulatory pathway, but we can do clinical trials easier. AI and new methods for drug discovery are very, very important. But ultimately, that's not where the big costs are. The big costs are where we come into the clinical trial arena. And their costs, I think, we could relook at the way we do clinical trials as one of the lessons that came out of COVID. We could do them quicker, we could do them better. And we can do them in the same level of safety and quality that we do at the moment, but we would be able to do more trials, and as a result, we would have more innovation.
More innovation, typically always a good thing and to be encouraged. But in terms of competition in the space, John, we'll give this final question to you. Within the sector, the drug development sector, is there too much competition? Does there need to be more competition law in place, or should further competition be encouraged?
Look, it's not my field to talk about competition law in the sector, but I think it's more about continuing this collaboration in these big public health matters post-COVID for me, and seeing what is needed to drive this. One of the things I've been really encouraged by is the formation of the mRNA hub now in South Africa, and the various spokes that are distributing these technologies, with a view to also addressing neglected diseases at the same time. So in some ways, it's less about the competition, but more about the distribution and making sure that we have research and development going on across the spectrum. I'm really convinced that the way, if we look at the current response to the epidemic, and as Jeremy said, it was based on 20 years of investment in these technologies, that actually what we need to do is to increase higher the bar in general about production, particularly in disease endemic countries, that can then be responsive when we have these particular things. So I don't think really it is about that competition. I mean, often the fact is the lack of interest rather than major competition.
Understood. Thanks to all of you, Jeremy, Barbara, Wolfgang and John. We really enjoyed that discussion. I know our viewers did too. Before the break, let's conclude with this message from Laura Pioveson, Deputy Director General of Projects Directorate at the European Investment Bank.
Over the past century, humankind has made enormous progress in fighting infectious disease through improved hygiene and sanitation, and the development and deployment of vaccines and therapeutics. However, a lack to equitable access to this technology has a disproportionate effect on lower-income population and disadvantaged groups in all countries. Antimicrobial resistance remains a massive problem. In 2019, it is estimated that almost 5 million deaths were associated with bacterial AMR, with the highest all-age death rate in sub-Saharan Africa. We need to take concrete actions to significantly reduce these numbers. AMR is but one challenge in the extensive list of communicable diseases to be tackled. How can we solve these problems? Government, seed funding and pre-purchase agreements created the necessary incentives for pharmaceutical companies to deliver the timely solutions that were needed. International financial institutions and development banks, including the EIB, did not shy away from the challenge and stepped up their efforts to support the sector. At the same time, the crisis gave rise to innovative models for pooling resources and technologies, optimizing access and sharing data with trusted partners around the world. Unfortunately, these solutions are not without their own obstacles. Many of the less financially profitable therapeutic areas are less attractive to larger players. It is therefore essential that not only financial, but also drug discovery, scientific and managerial expertise is readily available to catalyze investments in promising R&D. Intellectual property remains a critical element to incentivize innovation, and global distribution of innovative products does not hinge on IP alone. Biotech manufacturing is a highly specialized, controlled and sensitive process, relying on specific expertise, where barriers to access reach beyond just IP. Overcoming the hurdles calls for new joined-up thinking about how R&D is financed and incentivized, and how global and equitable access to products is achieved. To that end, there is growing talk about alternatives to the classic commercial model, such as remuneration models based on fixed installment or subscriptions. Another idea is to use government or foundation-funded market entry rewards for new antibiotics, vaccines, and overqualifying treatments. Creating more favorable financial conditions for green ventures within the industry may help to promote innovation in infectious diseases. We can be successful if we pool our resources together. We have all learnings from pandemics. Now it's our duty to leverage these and maintain the momentum, collaborating to drive better investment to combat disease.
We will be back after this next break to get down to the nitty-gritty of exactly how to break down barriers and get everyone to work together. So don't go away.
March 2020, COVID-19 came as a shock. Suddenly, patients flooded hospitals and death rates skyrocketed. Overnight, economies stalled and the world went into lockdown. 9 months later, BioNTech, with finance from the European Investment Bank, released the first messenger RNA vaccine to tackle the virus. Vaccines are key to overcome the pandemic, but they need to reach everybody, everywhere. This is why we support COVAX, the global initiative to provide equitable access to vaccines. Together with other European institutions, we are also boosting Africa's capacity to manufacture its own vaccines.
This funding is going to reinforce the health security in Africa. It would create jobs, develop capacities in terms of know-how and workforce, while bringing new technology and helping Africa to be self-sustainable when it comes to vaccine manufacturing.
We are ready to support the expansion of mRNA technology, which was used successfully in COVID vaccines, to develop new vaccines that eradicate malaria. And we continue to work to strengthen healthcare systems in lower-income countries, like the National Health Laboratory of Rwanda.
It's going to be a huge boost to our efforts into improving lab, looking at specialized testing like sequencing, like research.
In the Western Balkans, together with other European institutions, we are building and modernizing hospitals with state-of-the-art medical equipment.
Za radiologije koji smo sa novim mašinama dograđivali, prepravljali postojeći prostor koji je pravljen tamo negde posle ili u vreme drugog svjetskog rata.
In Morocco, we provide finance to support healthcare infrastructure that improves people's lives.
Pour moi, l'hôpital de Salé est un hôpital unique de la région parce qu'il est très spacieux, il est moderne, il est très bien équipé et il est très accessible à la population.
From 2017 to 2021, the EIB has invested 17.8 billion euros in the health and life science sectors. In 2021 alone, more than 780 million people around the world are benefiting from our healthcare investments. COVID-19 is a wake-up call. It reminds us that health is a global priority. At the EIB, we continue to ensure that countries are ready to respond better and faster to future health challenges. March 2020, COVID-19 came as a shock. Suddenly, patients flooded hospitals and death rates skyrocketed. Overnight, economies stalled and the world went into lockdown. 9 months later, BioNTech, with finance from the European Investment Bank, released the first messenger RNA vaccine to tackle the virus. Vaccines are key to overcome the pandemic, but they need to reach everybody, everywhere. This is why we support COVAX, the global initiative to provide equitable access to vaccines. Together with other European institutions, we are also boosting Africa's capacity to manufacture its own vaccines.
This funding is going to reinforce the health security in Africa. It would create jobs, develop capacities in terms of know-how and workforce, while bringing new technology and helping Africa to be self-sustainable when it comes to vaccine manufacturing.
We are ready to support the expansion of mRNA technology, which was used successfully in COVID vaccines, to develop new vaccines that eradicate malaria. And we continue to work to strengthen healthcare systems in lower-income countries, like the National Health Laboratory of Rwanda.
It's going to be a huge boost to our efforts into improving lab, looking at specialized testing like sequencing, like research.
In the Western Balkans, together with other European institutions, we are building and modernizing hospitals with state-of-the-art medical equipment.
Radiologije koju smo sa novim mašinama dograđivali, prepravljali postojeći prostor koji je pravljen tamo negde posle ili u vreme drugog svjetskog rata.
In Morocco, we provide finance to support healthcare infrastructure that improves people's lives.
Pour moi, l'hôpital de Salé est un hôpital unique de la région parce qu'il est très spacieux, il est moderne, il est très bien équipé et il est très accessible à la population.
From 2017 to 2021, the EIB has invested 17.8 billion euros in the health and life science sectors. In 2021 alone, more than 780 million people around the world are benefiting from our healthcare investments. COVID-19 is a wake-up call. It reminds us that health is a global priority. At the EIB, we continue to ensure that countries are ready to respond better and faster to future health challenges.
Hello there and welcome back to our third and final session of the day, Health Without Borders. Disease is, of course, no respecter of borders, but too often health systems erect barriers between countries that make it harder to tackle common problems. How then can we succeed in bringing public and private, government and multinational, high and low income countries together?
President Emmanuel Macron addressing the nation yesterday. He's locked down the country. And this is what he said: we are at war. A public health war, certainly, but we are at war.
It never stops. They're telling people to stay indoors. It's quite scary. You don't really get used to it.
Well, we will speak to our next and final panel in just a moment's time, but first let's hear from Martin Seychelles, Deputy Director General, DG International Partnerships at the European Commission.
Diseases have no borders, and therefore we have learned the hard way that healthcare provision must be resilient and a priority for governments in order to ensure the prosperity and well-being of nations. Global health action has two sides. On one hand, it encompasses global cooperation through multilateral and bilateral relations to promote and safeguard the health of our own population. On the other, it includes actions to support health in partner countries, such as through humanitarian and development assistance, outbreak response, and vaccination. Two major policy developments have been put forward: the Global Gateway Strategy and the renewed Global Health Strategy. The European Commission and the High Representative for Foreign Affairs and launched the Global Gateway Strategy, which aims to mobilize up to 300 billion euros in investments. Global Gateway projects are being developed and delivered through Team Europe initiatives, TEIs, involving EU member states and European development financing institutions. A priority sector under Global Gateway is health. Health TEIs revolve around vaccination, access to medicines, One Health, sexual and reproductive health rights, public health institutes, and digital health. Together with Global Gateway, in May 2022, Commissioners Urpilainen and Kyriakides announced a new EU Global Health Strategy. Europe stands ready to lead by example on the basis of our own healthcare systems that promote equal access and universal coverage and address regional and cross-border health issues. The strategy should help shape a new global health order with a multilateralism that delivers and with WHO at its center. These new policy approaches are already crystallizing in concrete actions. Last year, we launched MAV+, the Team Europe initiative on manufacturing and access to vaccines, medicines, and health technologies in Africa. Together with our European member states, the EIB and other European financial institutions, we have already mobilized over 1.1 billion euro towards facilitating local manufacturing and access to essential health products and technologies. Earlier this year, the European Commission President participated in the launching of the Vaccine Equity for Africa project at the BioNTech headquarters, which is now advancing and has been praised by African leaders. Manufacturing plants are being built or upgraded in countries like Senegal, South Africa, Rwanda, and Ghana. Sharing the mRNA or other health technologies is just a part of our collective, comprehensive actions. The EU is supporting the creation of the African Medicines Agency, and we are connecting European and African regulatory agencies through twinning and sharing of best practices to build the environment needed for Africa's blossoming pharma industry. We will be enhancing the skills of local professionals. This could be a game changer, and we are preparing a partnership with Latin America and with the Caribbean too. Because partnerships are the vehicle to deliver true, positive impact.
Martin Seychelles speaking to us there. Now let's finally introduce that panel of ours. Pleased to say we're joined by Dr. Özlem Türeci, who's Chief Medical Officer, of course, at BioNTech, Vidya Vasudevan, Director of the Strategic Investment Fund at the Bill and Melinda Gates Foundation, Professor Peter Piot, Special Advisor to the President of the EC on COVID-19 and former Director of the London School of Hygiene and Tropical Medicine, and last but by certainly means not least, Dr. Gaunder Silberschmidt, Director of Health and Multilateral Partnerships at the World Health Organization. Welcome to all. Got plenty to cover. Let's start by looking at this clip.
Once seamless borders, now controlled. Europe's unity facing new strains. And nowhere starker than the border enclave town of Barlo. This is Belgium over here and the Netherlands over here, B and NL. And the border crisscrosses this town right through the middle of the road, creating a dizzying array of divisions that coronavirus lockdown is driving to previously unseen proportions.
Let's begin by going to you, Peter. That report demonstrated us there that lack of joined-up thinking across borders. Some might even say it was somewhat absurd that that border between Belgium and the Netherlands had that divide. Would you agree with that? And how do we overcome this? Unfortunately, I was just going to interrupt you there to say we didn't have your audio.
After all these years, I haven't learned it. Sorry. Hello, everybody. No, I mean, this was definitely a big issue at the beginning of the COVID pandemic with just when you look at Europe, member states closing their borders for even export of diagnostics, of protecting materials. But that was about the first action that the EU took to keep the borders open. That has been quite an interesting development, just as Brexit has unified Europe much more, maybe also Ukraine, but also COVID. And it's just simply an illusion that you can control a virus, any virus, just within borders of what after all small countries.
And it was absolutely represented by the COVID pandemic. And it was a reminder that even though we've got this era of mass globalization, Gaudens, I'll come to you now, health seems to be one area that resists that kind of global harmonization. Is that something you'd agree with?
Yeah, I go perhaps first back in history. At the peak of the Cold War, WHO with the Soviet Union and the US have jointly eradicated smallpox. So yes, it does resist if you take healthcare systems, but global health doesn't resist. I would rather say, and going back to what Martin said as WHO at the center, but also what Peter was saying, I mean, we gave the alerts. We never advised to close borders, but national government had to be seen to do something. So it was often a late, but then a very strong reaction. So some of the systems were in place, but not sufficiently known, and we have to work in strengthening the system and the tools, but also that they're known and that they're implemented and followed.
Understood. It'd be good to get a sense now from a developer, a scientist, of what it feels like to work within this framework. Özlem, let's come to you, because when a company like yours is developing drugs and vaccines, give us a sense of the frustration sometimes there must be with dealing with such wildly different regulatory frameworks.
We are already used to those frameworks which are siloed across borders, and also the siloing of the different stakeholders along the development process for novel medicines. So this was not a new experience for us. However, what I would like to acknowledge is that under a joint sense of urgency in the pandemic, stakeholders managed to overcome this siloing and in principle work out on the go some level of harmonization, which was the reason why at the end of the day we were able to develop and authorize our vaccine so fast.
And could I just ask you, Özlem, to give us an example of those types of different regulatory frameworks that you came up against in the development, for example, of the COVID vaccine?
For example, EMA and FDA have very different regulatory frameworks, and it was very important to have a dialogue with both regulatory authorities, and also very encouraging to see that they were harmonizing among themselves and were in a continuous dialogue, learning from new data, which was coming up in the clinical trials and by the rolling submissions into both agencies. That was an experience which went on for the first couple of months of developing our vaccine.
It's really interesting to know that and get your experience. Thank you. Vidya, I want to come to you now, because of course it's not just national borders that scientists have to come up against when trying to create life-saving drugs, but the friction between public and private sectors as well. What can you tell us about that?
Yeah, I mean, I think the thing that was really interesting in the pandemic is that friction in some ways went away. There were so many different funders that kind of came together to support the development of life-saving medicines, vaccines, diagnostics. And it actually, in some ways, we saw much greater risk-taking across the board than we see in quote-unquote peacetime, right? I think one thing the foundation believes is that there needs to be significantly greater investment in late-stage development of these life-saving products, or getting products ready for late-stage development so that when pandemics or outbreaks happen, we have products on the shelf that we can support. I would say several national governments, private funders, philanthropic funders stepped forward to fund, given the shared nature of this pandemic and the shared risk that everyone was facing. So I think this was actually an example where the public sector and private sector and philanthropic sector came together, and hopefully is an example that can be followed in peacetime to develop a lot of infrastructure that can be used for future threats.
Yeah, hopefully indeed. Now, we are spending a lot of time today talking, of course, about the recent COVID pandemic, but many of you will remember further back, 2015, when the world came together to agree those sustainable development goals. Here's a reminder of what happened.
It is so decided.
With the UN's official adoption on Friday of 17 goals for ending extreme poverty, fighting inequality, and tackling climate change by 2030, world leaders signaled their commitment to a bold new global agenda. Meanwhile, leaders from almost 200 nations addressed the General Assembly Hall throughout the weekend in support of the post-2015 development agenda.
Today we can say to all the people around the world, 2030 agenda is for you, it's for everyone, everywhere.
Gardens, I'll come to you now, because these were really an astonishing agreement for countries around the world to work together in agreement and in harmony. But how can we build on what's been achieved in health with these goals so far?
I think prior to the pandemic, we made on especially the Sustainable Development Goal 3 on good health and well-being enormous and good progress. Then, as others were saying, we had at the beginning of the pandemic really good partnership efforts and really good collaborations, but this trickled away and we are now set back a lot. So we had in plenty of areas of health other than COVID been set back, be it non-communicable disease, be it mental health, be it the big disease, malaria, tuberculosis, HIV. And we really need new investments and innovative investments, such as we are now working from WHO with the EIB and others, to catch up with the SDG and SDG 3.
Let's stay with the theme of multilateralism. Vidya, I'll come back to you and that hope you had for collaboration within peacetime, as we're calling it. Now, governments are limited to, of course, acting within their borders most of the time. In an ideal world, who would you have step in to coordinate between different national governments and multinational corporations and other networks?
Yeah, I would say the governments are not limited just within their borders. So much of the global health ecosystem funding, et cetera, comes from national governments, and it's incredibly important that they continue to support several of these programs like the Global Fund and Gavi and others. I think that additional actors can certainly step up. There's several philanthropic funders out there that are focused on the SDGs, that are focused now on infectious disease and vaccines post-pandemic. There are actors like the EIB and others that can step forward. So I think the challenge that we have is there are other stressors, right, on the environment, like conflict that is happening around the world, Ukraine and other places, and economic challenges that are happening. So everybody is feeling stretched, but now is not the time to kind of pull back, right, from investing in these areas. And I think the thing that we think at the foundation is the private sector is incredibly important. That's where a lot of the innovation is coming from, but it can't always be innovation at the time of the stressor. And so it's important to support develop R&D, early stage R&D for new technologies that can be responsive to certain different threats and also be fit for purpose to these geographies in lower and middle income countries. And that investment needs to take place now. And that's something that we're working on with several partners out there that are interested in kind of advancing technology and R&D.
Now, speaking of the private sector, as you did there, let's go back to Özlem, because talk to us a little bit about the collaboration that was achieved between BioNTech and Pfizer, for example, between Germany and America. Does that show us that businesses could collaborate across borders more?
Not only businesses. What we, from our perspective, have seen during the pandemic and within our experience of our journey of developing our COVID-19 vaccine was that there can be new models of private-private, but also public-private partnerships, and they have been, from our perspective, a key success factor. One of the learnings was, and this speaks to our partnership with Pfizer, that in the context of this global crisis and with a sense of urgency, the partnership was not the typical transactional partnership often seen between companies, but more relational, because it was clear that we wanted to achieve a joint goal together. As I said, not only the partnership with Pfizer, but also the close collaboration and continuous dialogue with governments, with regulatory authorities, with funders, like the EIB, for example, was very important and showed that novel models of PPPs can provide tailwind in such situations of crisis, and we should ensure that we further build them in situations of peace to be better prepared.
Understood. I want to come back to Peter now, because we began by talking to you about some issues cross-border, but let's now talk about some solutions. We've talked about a few already, but what did the COVID pandemic, highlight to you about cross-border solutions and possibilities for them?
Well, you can look at it whether the glass is half full or half empty, but frankly, in my life, I've never seen so much collaboration, partnerships across borders, across sectors as during this epidemic. There's so many examples that this has been unprecedented global collaboration, also at the scientific level in terms of sharing data, sharing samples. That seems like obvious, but in reality, in the past, this hasn't been. And this partnership started also before COVID. For example, the creation of CEPI, the Coalition for Epidemic Preparedness Innovation, which is targeting the development of vaccines where there is no market incentive, for example, for Ebola, Lassa, and so on. And that started after the devastating Ebola epidemic in West Africa. So I think there are quite a lot going on. Actually, I think the issue today is that there's so many initiatives all over. I mean, and rightly so. I mean, I'm in Japan at the moment. That's why it's dark behind here. Japan has just launched SCARDA, over €1 billion initiative to develop vaccines. Italy, we in Europe, we've set up HERA, as we just heard today, the Health Emergency Response Authority, and there are many other initiatives, longer and not. And it'll be important not only to collaborate, but also to make sure that there is, exchange of data, transparency, and all that. And above all, I would say one of the lessons of this epidemic is that, of course, I'm never used the word vaccine nationalism. I think is absurd because a prime minister or a president is elected in a democratic system by the citizens of that country. So they have to take care of their own country. That's a big, big argument to support manufacturing in, for example, a continent of Africa, as we just heard from Amadou Sall in Dakar, for example. And that's what we need to invest in now, as Martin Seychelles said, over €1 billion that the EU is investing in this, that we can be ready for the next epidemic. And whether this be regional epidemics or a pandemic, they will come. Let's not, it's hard to predict the future, but that's going to happen. So let's also not invest, not only deal with the short term, but also have long-term investments that will make sure that we are a much safer place for citizens all over the world.
I'm glad you brought up that term vaccine nationalism. We will come back to it very shortly. But first, you also mentioned Asia. Thanks for joining us from Japan, where it must be late this evening. We want to show you this graph, and we're going to ask Vidya on this one about looking at that data, that drop-off in collaboration between superpowers, America and China. Now, Vidya, you already mentioned the global stressors, as you put it, going on. Geopolitical stresses, of course, being a key one here. What concerns you about a lack of scientific collaboration between China and America?
Yeah, we aren't geopolitical actors, so I don't want to comment on any specific kind of relationships between countries. I think more broadly, I think what is concerning is just the economic crises that are going on both in developing countries as well as developed countries means there's just less resources, right? There's more challenges in the world than there's ever been before, and there's seemingly less resources to kind of go against those. So we're seeing funding get challenged, and it's challenging to keep the same level of support. So I was more commenting on that. Scientific collaboration is incredibly important. I think it happens at all levels, and we did see an unprecedented level of collaboration, sharing of data, sharing of sequences, technology being made available kind of through waivers and things that happened. And so I think I would celebrate those successes, but you can't take your eye off the ball there going forward.
But does it concern you when potentially politics does have a point to play in a lack of scientific collaboration? I understand you're not speaking from the point of a political body, but is it just a concern as a scientist?
Yeah, it's certainly a concern, right? Because you want the best minds and the best technologies to come together. We're talking a lot about the COVID pandemic, but we're talking about SDG 3, which is about broader global health. And certainly, as Peter mentioned, we're very focused on the big three diseases, right? HIV, TB, and malaria. And in several of those diseases, you want actually probably to deploy several technologies together, whether you're preventing or treating the disease, which requires collaboration across scientists as well as private sector partners, right? Bringing antibodies together with T-cell vaccines or whatnot. And so it is concerning if politics prevents those actors from being able to collaborate and bring those technologies together so we can have the best arsenal of drugs and vaccines to prevent and treat these diseases.
Understood. Thank you for commenting on that. Gerdens, we want to come to you now and pose you that debate that Peter introduced to us about vaccine nationalism, if we can call it that. Peter doesn't like the term, but aren't governments always going to put their own constituents, their own voters, their own citizens first? Is that a hurdle that can never be overcome?
I think the fact, as Peter was rightly saying, that the incentive is there to look for your population first is there. So we have to build a system which works despite those incentives. So we're looking into regionalizing production in the sense not every country should, but creating interdependence, that there is no incentive to close the borders, that the supply chains are working, and that we can build on that fact, coming back to the question of the nationalism or the geopolitical fault lines. Our experience was that the scientists, that the private sector, that plenty of actors that we were convening were actually, despite the fault line, totally collaborating across. So the question is to encourage that collaboration and to acknowledge that national governments have to first serve their population, but give them the possibility to serve the global community at the same time.
Özlem, speaking from the point of view of the drug makers, the vaccine makers, do they remain neutral in this situation, or is there a role that they can play in helping tackle the idea of, if we're going to call it, vaccine nationalism?
Can you repeat? You were breaking up here on my side.
Of course, of course. Is there a role that the vaccine and the drug developers can actually take in helping tackle so-called vaccine nationalism?
I think that vaccine developers also have the obligation to contribute to a broad rollout and to democratizing access to innovative medicines. And this is, for example, what we do by deciding to go to Africa, to the African continent with our vaccine technologies. I see this as an obligation also of developers to help overcoming that the access to innovative medicines stays within borders.
Understood, thank you. And picking up on that point, Peter, I'll come to you. On democratizing access, when we do have international collaboration and partnerships, Western countries do seem to dominate and control a lot of that process. Can you explain to us why that might be, and if there is any kind of fix to it?
Well, first of all, I have a lot of experience when it reminds me all of the AIDS epidemic, where in 1996, it was announced that AIDS was no longer a death sentence and that you could treat people with HIV with the triple therapy, but it was $14,000 per person per year. So that was inaccessible for most people with HIV in the world, particularly in sub-Saharan Africa and in other low-income countries, or in countries without a health insurance system, like in the US, for example. So what we did is we fought very hard to bring the prices down through a number of mechanisms, including generic manufacturing in India, but also making sure there was money, and that's how the Global Fund was created. So it's a matter of I would say local manufacturing. It's a matter of price, and differential prices. It's a matter of making sure there's money available, even something that is very cheap. Someone has to pay for it. And it's a matter also of having, Scotland said, mechanisms, international mechanisms that can ensure all that. Nothing is going to be perfect, but I think we've made enormous progress in that field, but still a lot is to win. But without money, it's not going to happen. But also, I would say that one of the silver linings of this COVID epidemic is, for example, in sub-Saharan Africa, that the African Union and through the Africa Center for Disease Control have taken things in hand and have not waited for wealthiest countries to, in terms to show some charity and to, but negotiated with companies, but also benefited from the support of, for example, the EIB, of the EU, from others, to, invest in this kind of negotiations, in also in local manufacturing. So I'm always very suspicious of people who tell me, if you only do this, you're going to fix it. No, it's a number of measures that have to be taken, and not just in terms in the short term, but we have to sustain them. Also, someone used the word peacetime, and not just start getting it all out again when the next epidemic is coming. And let's not forget, COVID is not over. We shouldn't have any illusion. We're already seeing an increase in cases, not only in Europe, but also in other parts of the world.
You spoke a little bit about an internationalist approach. Could you give us an example of one of those?
Well, I think there is it is at the whole, in the whole pipeline to say so. On the one hand, it starts with R&D, where of course companies are at the foundation, but there needs to be market incentives. This is where CEPI is important. In Europe, we have the IMI, the Innovative Medicines Initiative, that really funded, for example, one of the two Ebola vaccines that are available. And let's not forget, there's a very, very risky Ebola epidemic that is starting in Uganda. It has already killed several doctors. Today, Muhammad Ali died from Tanzania. And I just don't get it that the international community, that there is no policy also from WHO to offer this kind of vaccines for at least healthcare and prime care workers in the field. We have also, as I mentioned, various initiatives at regional level, but also at local level. COVAX has been mentioned, but we need more. And then at the financial side, recently at the World Bank, there was an agreement was reached with several countries, both from the donors, but driven by the G20, chaired by Indonesia, to establish the Financial Intermediary Fund, which should also make it possible to fund the strengthening of capacity in the countries that are most at risk to be better prepared and to be better ready when the next epidemic hits. And so there are lots of initiatives, but what I think is really important is to bring them together in a coherent way. That is at the moment is lacking, I would say.
Something we spoke about a bit in the last session was clinical trials and the key role that they played and are continuing to play. We're going to show you this graph now, and Gaudens, it shows how clinical trials have been accelerated across so many borders. Can you speak to us a little bit about why this is so important?
As an example, that usually those trials or also the other studies started always in high-income countries. With the pandemic, through the Solidarity Response Fund, we had the seroepidemiological study starting in all countries at the same time. So it's not just for a Western population, but for all countries at the same time. Or I can perhaps illustrate it also with the project which was at the start of the EIB-WHO collaboration, which we're celebrating through that event today. That was the malaria investment of the EC and the EIB. Now, we had broadened into primary health care, into other areas to work with the EIB, but that malaria investment is actually now investing in BioNTech's research in using that new mRNA technology to bring it to malaria, to bring it locally with clinical trials that we are organizing in Africa. So it shows that what we learned in the pandemic, we can and must take it beyond and take those innovative partnerships into all countries on all continents.
Thank you for making those comments on the clinical trials. Just finally, before we wrap up this conversation, previously we spoke a little bit about artificial intelligence for the last panel. Vidya, we want to come to you on this and talk a little bit about the role technology can play in breaking down borders.
Yeah, I mean, there's so many directions one could take that. I mean, we're seeing applications of such amazing technology all across R&D and drug development. I mean, I think, so I sit within the team at the Gates Foundation that invests in companies in the private sector to advance our mission. We're investors in BioNTech and have had an amazing collaboration around TB and HIV there. I would say, you know, one thing we're seeing a lot in the companies that are coming to pitch to us is the application of AI and ML across several different areas. One is drug discovery, right? Using AI ML to actually just either discover new targets or discover new compounds against targets, and in a very efficient way, try to kind of narrow down which of those compounds you want to test in clinical trials without having to go through expensive synthesis for several kind of molecules before you test. We're seeing the same thing on several other aspects of the chain. You know, how can we find better delivery mechanisms for mRNA vaccines than these lipid nanoparticles? So there's a lot of application of those technologies, I think, in the R&D drug discovery process. We're also seeing very interesting applications of AI ML in health delivery. So in terms of how can you more efficiently deliver healthcare using chatbots, obviously there's telemedicine, but can you actually use AI to triage a lot of the early questions so that you can give people better healthcare utilizing your resources more sparingly? So that's an area that we're looking at. And also availability of medicines, like in the pharmacy sector, can you use AI ML and better data to ensure that there's no stockouts of essential medicines that are out there in these, you know, mom and pop chemist shops, which is where most people are seeking healthcare in the developing world. So I think technology is extremely promising and it's being applied across the board, and hope to see more successes over the next few years.
So to a nice optimistic note to round off this discussion. It's been great. Thank you to all of you, Özlem, Vidya, Peter and Gaudens, and thank you all. Let's hear now from Christoph Kuhn, who's Director, Mandate Management Department at the European Investment Bank.
Achieving good health and well-being for all requires a common response and a broad collaborative effort by people and organizations across countries and sectors. The question then is, how can we deepen these global partnerships and find collaborative solutions? What opportunities lie ahead? Although we believe in a globalized world, many of the stakeholders that are needed to achieve good health and well-being for all are siloed across borders and sectors. Rules and regulations differ drastically across countries. Drugs or medical devices that are approved in one jurisdiction might not be approved in another. Methods of sharing and categorizing health data might differ from one area to the next. None of this bodes well for the kind of collaboration that is needed to deliver on SDG 3. When a crisis like COVID-19 pandemic emerges, it can become even more difficult, as most governments' first instinct is to put their own interests first. This is understandable. But it also leads to injustices like vaccine nationalism and the hoarding of critical supplies, as well as counterproductive restrictions on immigration and expertise. Despite these issues, the pandemic has generated some major collaborative success stories.
Breaking news from Pfizer this morning about its vaccine and a 90% efficacy.
Data sharing among scientists allowed for the virus to be sequenced in January of 2020, starting the clock for the development of the vaccines. And then the first mRNA vaccine approved came from a partnership between the German startup BioNTech and the American pharmaceutical giant Pfizer, a project that was supported by the EIB. At the global level, governments and civil society came together to launch a suite of new multilateralism.
Tensions have been soaring following U.S. House Speaker Nancy Pelosi's visit to Taiwan.
Unfortunately, the new geopolitical sphere has further complicated the picture. Sino-American rivalry and Russia's war on Ukraine have led to a proliferation of sanctions. and new national security concerns that are hampering the cross-border sharing of technology, data, and know-how. Other hurdles are more long-standing. The old donor-beneficiary model, it is said, tends to result in rich countries calling the shots for the poor countries. And of course, both national concerns and power disparities also can hinder cooperation within political, economic areas like the European Union. Early border closures and other pandemic episodes showed that many barriers to ever closer health coordination still need to be addressed and improved. However, I think we can remain optimistic about the future. We need to continue to nurture partnerships and collaboration that can develop and deploy suitable financial solutions to catalyze greater private sector engagement and capital, which will strengthen health security and resilience. And this is the only way how to achieve the objectives laid down in SDG number 3. Thank you very much.
The European Investment Bank's Christophe Kuhn there. Well, we are delighted to have the final word on today's fascinating event from the former Prime Minister of New Zealand, Helen Clark.
Greetings to all who've been participating in this very important and timely discussion on investing in health for all. I think it's very important to be looking forward, but as we do, let's not lose sight of the COVID-19 pandemic, which unfortunately remains very much with us. WHO has said that the end of the pandemic is in sight if all countries and stakeholders do the hard work to prevent, track, treat and communicate clearly about COVID-19, and that's nowhere near happening yet. The Independent Panel for Pandemic Preparedness and Response, which I was honoured to co-chair, proposed a package of recommendations aimed at stopping future health threats from becoming pandemics as devastating to health, societies and economies as COVID-19. A core element of that is indeed to build more resilient national health systems, which can adjust rapidly to deal with crises while also maintaining core services. The new pandemic fund at the World Bank, in coordination with WHO, requires at a minimum $10.5 billion every year, mostly to invest in safeguards in low and middle income countries. But so far, this fund has commitments totaling just over a tenth of that amount. That's not sustainable funding. The Independent Panel recommended the creation of a Global Health Threats Council, a multilateral, multi-sectoral, inclusive council led by heads of state and government and including representation from civil society and the private sector. There are, of course, different views about how such a council could be formed and where it should reside. Our panel thought it should not sit only within the WHO constitution because the management of pandemic threats extends far beyond the health sector. In closing, let's remember COVID-19 is reported to have killed 6.5 million people. But the actual estimates of excess deaths during the pandemic are ranging upwards from 17 to 22 million people. We simply cannot let a tragedy on this scale happen again. We must act on the lessons of our collective failure to stop the threat of COVID-19 from becoming a pandemic. We need political will globally to do this. When the very future of the planet and its people are imperiled, leaders have a responsibility to step up and act. And I hope they will. Thank you.
Thank you, Helen Clark. Well, that is all we have time for today. We want to thank you all so much. Thanks to our contributors for making this such a wonderful event. And thank you to everyone behind the scenes at Project Syndicate and High Impact who've worked so hard to make this event happen. But most of all, thank you to you, the audience watching. It really would be nothing without you. I'm Rosanna Lockwood, and this has been Investing in Health for All, brought to you by Project Syndicate. Goodbye.